Depression is a serious mental health condition affecting millions worldwide. It's more than just feeling sad or down. It's a complex illness with long-lasting effects on a person's thoughts, feelings, and behaviors. The World Health Organization recognizes depression as the leading cause of disability globally, impacting people of all ages and backgrounds. In the United States alone, nearly 10% of adults experience depression each year. Its prevalence highlights the urgent need for greater awareness, understanding, and support for those affected. Many individuals struggle in silence, unaware that what they're experiencing is treatable. The stigma surrounding mental health often prevents individuals from seeking the help they need. It's crucial to remember that depression is not a sign of weakness. It's a medical condition that requires professional attention and care, just like any other health concern. It's important to differentiate between sadness, a normal human emotion, and clinical depression, a medical condition. Sadness is a natural response to difficult life events. We all experience sadness from time to time, whether it's due to a disappointment, loss, or setback. These feelings are usually temporary and fade as circumstances change. Clinical depression, on the other hand, is more intense and persistent. It's characterized by a pervasive sense of hopelessness, despair, and loss of interest that lingers for weeks, months, or even years. This persistent low mood significantly interferes with daily life, affecting work, relationships, and overall well-being. Depression manifests differently in each individual, but there are common symptoms that doctors look for when making a diagnosis. To be diagnosed with clinical depression, a person typically experiences at least 5 of the following symptoms for a period of 2 weeks or more. A depressed mood that lasts most of the day, nearly every day. A loss of interest or pleasure in previously enjoyed activities. Significant changes in appetite or weight. Sleep disturbances such as insomnia or oversleeping, fatigue or loss of energy. Feelings of worthlessness, guilt or hopelessness. Difficulty concentrating, thinking clearly, or making decisions, and recurrent thoughts of death or suicide. If you or someone you know is experiencing several of these symptoms, it's essential to seek professional help. A healthcare provider can properly assess the situation, make an accurate diagnosis, and recommend the most appropriate course of treatment. Section 4. The physical reality of depression, impacts on the brain. Depression is not simply a state of mind, it has tangible effects on the brain. Research has shown that people with depression often exhibit physical changes in brain structure and function. For instance, studies using brain imaging techniques have revealed that certain areas of the brain, such as the hippocampus, which is involved in memory, and the prefrontal cortex, responsible for decision-making and emotional regulation, tend to be smaller in individuals with depression compared to those without the condition. These structural differences can impact various brain functions, including mood regulation, sleep patterns, appetite, and cognitive processes. Furthermore, depression is associated with imbalances in brain chemicals called neurotransmitters. Neurotransmitters such as serotonin, dopamine, and norepinephrine play crucial roles in regulating mood, motivation, and pleasure. In individuals with depression, the levels of these neurotransmitters are often disrupted, contributing to the emotional and behavioral changes observed in the condition. Section 5. Seeking help and finding effective treatments. One of the most important things to remember about depression is that it is treatable. With the right support and interventions, individuals can experience significant improvement in their symptoms and overall quality of life. The first step towards recovery is seeking professional help. A healthcare provider can conduct a thorough evaluation, make an accurate diagnosis, and recommend the most appropriate treatment plan. Effective treatments for depression often involve a combination of approaches tailored to the individual's needs. Medications, such as antidepressants, can help to correct chemical imbalances in the brain, alleviating symptoms like low mood, fatigue, and sleep disturbances. Psychotherapy, also known as talk therapy, provides a safe and supportive space for individuals to explore their thoughts, feelings, and behaviors, develop coping mechanisms, and work towards positive change.